Hi, my topic is about diabetes self-management education. Diabetes is a major public health problem with rapidly increasing prevalence. In 2017, the global prevalence of diabetes among people aged 20 to 79 years old was 425 million, mainly comprising either type 1 or type 2. Diabetes is one of the top 10 global causes of mortality. International audits have found that treatment adherence is less than optimal in both type 1 and type 2 diabetes. As a sequence, uh, this majority of these patients are at risk for serious health complication and which impose a great economic burden on the individual and the healthcare system. Diabetes is a complex and challenging disease that require daily self-management decision made by a diabetic person. Diabetes self-management education addresses the comprehensive blend of clinical, educational, psychosocial, and behavioral aspects of care needed for daily self-management and provides the foundation to help all people with diabetes navigate their daily self-care with confidence and improved outcomes. Consistent engagement diabetes self-management has been found to be correlated with the attainment of health outcomes in terms of good blood glucose control, fewer complications, improved quality of life, and the reduction diabetes related health risks. Self-management refers to day-to-day activities or action the individual must undertake to control or reduce further illnesses. Diabetes self-management action involve engagement in recommended behavioral activities such as healthy eating, medication adherence, being active, glucose monitoring, reducing risk, problem solving, and healthy coping, which are all necessary for the successful management of the disease. Literature has supported the effectiveness of diabetes educational and behavioral intervention in improving psychosocial and health outcome. Diabetes self-management education, as concluded from the literature, are highly effective in improving glycemic control, lipid profile, body mass index, and some effect on improving blood pressure. Thus, they can reduce the risk of developing diabetes complication. Patient diabetes knowledge, behavior, adherence to medication, self-efficacy, and quality of life can be also significantly improved by diabetes self-management education. The literature reveals that self-management education is the gold standard for diabetes management and has been proven to be an integral component in the care of diabetes. The study will be conducted in a community-based clinic. Participant adult age 18 and above. Educational session will be provided every week for around 30 minutes. Pre-test, post-test interview and observations to assess knowledge before after education classes. The project's measures will be through periodic evaluation of hemoglobin A1C, fasting blood glucose, and BMI. This will be recorded at the initial visit, at 3 month mark, and lastly at the 6 month mark. Also, printed diabetes education materials will be provided with colored pictures for participants. More program can be developed by organizations that emphasize self-management support to sustain behavior at level that will promote successful diabetes management. Nurses are in a unique position to incorporate various strategies such as follow-up care, educational and behavioral goal setting to sustain the ongoing behavior that will assist diabetes patients to manage their disease. Diabetes education programs are cost effective by reducing hospital admission and readmission. Healthcare community responsible for delivering quality care mobilize effort to address the barriers and explore resources for diabetes self-management in order to meet the needs of adults living with managing their diabetes. Organization can develop a monitoring program to teach nurses to provide diabetes self-management education, educate clinical staff on the value of multidisciplinary team approach to diabetes care. Also, identification of barriers for education. Further projects should benefit from a larger sample size and longer follow-up period that would strengthen the project result.